The wrist extensor muscles. The wrist extensor's muscle group is located on the posterior aspect of the forearm. The group is composed of three muscles: the extensor carpi ulnaris, the extensor carpi radialis longus, and the extensor carpi radialis brevis. This muscle group functions in grasping movements of the hand. Let's take a look at the landmarks for the wrist extensors. We have the ulna, the radius, and the carpal bones. The extensor carpi radialis originates along the supracondylar ridge of the humerus. The extensor carpi radialis brevis originates on the lateral epicondyle of the humerus. Both insert on the second and third metacarpals. The extensor carpi ulnaris muscle originates on the lateral epicondyle of the humerus and the ulna. And the extensor carpi ulnaris muscle inserts on the fifth metacarpal. Contraction of the wrist extensor muscle group produces wrist and hand extension. The finger extensors assist the wrist extensor muscles during hand extension, and the wrist flexors oppose the wrist extensors during wrist and hand extension. Clinical findings for the wrist extensor trigger points. Clients may complain of pain on the back and outside of the wrist and occasionally near the lateral epicondyle. They will describe a pronounced weakness of the grip, with objects frequently slipping from their grasp. Activating and perpetuating factors for trigger points in the wrist extensors include playing tennis, weeding with a trowel, prolonged frisbee throwing, ironing, extensive handshaking, and prolonged immobilization of the arm after a shoulder injury. Referred pain from trigger points in the scalene, supraspinatus, and serratus posterior superior muscles can activate trigger points in the wrist extensor muscles. Brachioradialis trigger points are functionally associated with those in the wrist extensors. Common misdiagnoses for active trigger points in the wrist extensors include lateral epicondylitis or tennis elbow, C7, C8 radiculopathy, carpal tunnel syndrome, and arthritis.